Bismillahirrahmanirrahim. Today we will discuss anatomy of external ear and pinna. So why this picture is here? Because this beautiful lady having multiple piercing in the cartilage of the pinna. So this piercing can lead to severe chondritis, that is very painful condition. So, external auditory canal consists of pinna, external auditory canal, and lateral surface of the tympanic membrane. So, objective of this lecture is you should be able to describe the anatomy of the pinna and you should be able to solve this scenario in the end of this lecture. A boxer presented with painful swelling on the right pinna for the last 4 days. He is also having fever and swelling and pinna is highly tender to touch. What is your most probable diagnosis? What are the differential diagnoses and how will you treat the case? So in this beautiful picture you can see beautiful pinna. The outer part of pinna is helix and just anterior to helix is antihelix. And this is Simba concha, this is tragus, and opposite to tragus is antitragus. This is external auditory meatus, outer opening of external auditory canal. This is lobule that is devoid of cartilage. And this is Simba concha that is exactly opposite to the mastoid antrum. And you can, this is anterior and lateral surface of the pinna, and behind is the posterior and the medial surface of the pinna. So what is the blood supply of the pinna? Pinna is supplied by external carotid artery with superficial temporal artery gives some branches to the pinna, and also the posterior auricular artery give branches to the pinna, and some branches from the occipital artery also supply the pinna. So nerve supply of the pinna is also important. Why it is important? Because sometimes there is referred pain to the pinna. There is no disease of the pinna, but patient is complaining of pain in the pinna. So this is referred pain. So main supply of the medial or the posterior surface of the pinna is through greater auricular nerve through cervical plexus, and lower two-thirds is supplied by the greater auricular nerve. In the medial surface, upper one-third is supplied by the lesser occipital nerve, that is also through cervical plexus, and small part of the pinna that is connected to the bone. Most medial part of the medial surface is supplied by the 7th cranial nerve and the auricular branch of the 10th cranial nerve. Lateral and anterior surface, lower part is also supplied by the greater auricular nerve, upper part by the auriculotemporal nerve, and the small part by the lesser occipital nerve. And inside inner part of the anterior surface is supplied by the auricular branch of the vagus nerve and also the 7th cranial nerve. So whenever you are cleaning the external auditory canal, either you are doing suction in the external auditory canal or you are scratching the external auditory canal, patient can present with cough. So patient might have cough due to stimulation of vagus nerve. So what is the why blood supply is important? Because you sometimes you have to make some pedicle during some cosmetic surgery. So you should know about the blood supply of the pinna. Now lymphatic drainage, why it is important? Because infection can drain to these lymph nodes, and these lymph nodes can get enlarged, or malignancy can spread to these lymph nodes. So when you are treating the malignancy, you have to clean or clear these lymph nodes. Okay, so main lymph nodes are retroauricular lymph nodes that are behind the ear, superficial parotid lymph nodes that inside the parotid gland, and superficial cervical lymph nodes. That are the upper cervical lymph nodes. So in human being, pinna is usually vestigial, but in animals it collects the sound waves and directs it towards the external auditory canal. In human beings, external auditory canal has conduction of the sounds. It gathers the sound energies and focuses it towards the tympanic membrane. And there is also, because tympanic membrane, outer part of the tympanic membrane is keratinite squamous epithelium. So there is always desquamation of the epithelium. So naturally there is migration of these cells through posterior wall of the external auditory canal. So desquamated epithelium comes out through this posterior meatal wall and brings out wax through this migration, because outer part of the external auditory canal has ceruminous glands that form the wax. So wax is present only in the outer one third of the external auditory canal. And through this migration of the epithelium, this wax naturally comes out of the external auditory canal. Wax is also has antibacterial and anti-parasitic, antifungal and antiviral characteristics. So outer part contain hair. So any abnormality, any problem of the hair, that is usually boil, appear in the outer one third of the external auditory canal. So development of the pinna. Pinna and external auditory canal develop from the first and second branchial arches. So pinna develop from the 6 tubercles around the first branchial cleft. These tubercles join and fuse to each other and form the pinna. Failure of fusion of this tubercle or persistence of some tubercle leading to some congenital anomalies. So, external auditory canal is the first branchial cleft. So, failure of fusion can lead to some problem. So, any congenital anomaly that is common is bad ear. Bad ear is absence of anti-helix. So there is loop-shaped ears, absence of anti-helix. So this is cosmetically unacceptable and it can be treated by cosmetic surgery. We remove a part of skin in the medial surface and we stretch the skin of the medial surface to make artificial anti-helix. Microtia is small pinna. It is also cosmetically unacceptable, and this microtia may be associated with hearing loss, that can be conductive hearing loss or anomalies of the inner leading to sensorineural hearing loss. So whenever patient is presenting with microtia, you should investigate the hearing of the patient. In adults, this investigation is audiogram, and in children, this is BIRA or ASSR. BIRA is brain stem evoke response audiometry, and ASSR is auditory steady stimulatory response. So CT scan, you should advise CT scan, because CT scan can diagnose any blockage, any atresia, any anomaly of the inner ear. So treatment again is pinaplasty. If there is obstruction of external auditory canal, you can correct it through myotoplasty, or if patient is doesn't agree for surgery, so you can advise prosthesis. Anoxia is complete absence of ear, so it can also accompanied by some other congenital anomalies, conductive hearing loss, atresia of the external auditory canal, absence of the inner ear. So you should invest in acquired diseases of pinna. We also include inflammation. Inflammation may be due to infection, and infection of pinna are usually bacterial and viral. So in bacterial, we have discussed perichondritis, and now we will discuss viral and infected sebaceous cyst. In viral infections, commonest viral infection is herpes zoster. Herpes zoster is also called Ramsay-Hunt syndrome and or shingles. So it is caused by varicella zoster virus, that is DNA virus. It is the same virus that causes chickenpox in children. So after causing chickenpox, this virus may remain dormant in the body and then reactivate when immunity of the patient decreases. So what are the clinical features? Clinical features may be patient first of all will feel severe pain, and pain will be unilateral body, and in cases of head and neck region, pain will be in unilateral, means pain will be on one pinna. So after pain, patient will develop discoloration of the skin. Reddish discoloration of the skin is called erythema. Then after erythema, there will be blisters formation, and these blisters will be will contain clear fluid. So after rupture of these blisters, there will be scarring, black colored scarring. So these are the different stages of the disease, and this disease can cause paralysis of the seventh cranial nerve and the eighth cranial nerve. So patient can present with facial nerve paralysis along with erythema and blisters in on one side of the body, on one side of the face, that is usually on the pinna and around the external auditory meatus. And patient can also present with sensorineural hearing loss, one-sided sensorineural hearing loss. So what is Ramsay-Hunt syndrome? There will be unilateral facial nerve paralysis, there will be unilateral sensorineural hearing loss, and blisters and erythema on one side of the face, over the pinna and around the external auditory meatus. So treatment, because it is viral disease, so we will prescribe antiviral medicine, that is acyclovir. It can be given in the form of capsules and oral ointment, and local acyclovir ointment can also be given. Because patient feels severe pain, so we will give analgesics and sometimes sedatives. We can also prescribe steroid to reduce this pain. So now boil is the localized infection of hair follicle caused by Staph aureus virus. Clinical features include severe pain and swelling. Swelling will be reddish in color. You can see in this picture, swelling is reddish, and it is painful swelling because cartilage of the pinna is continuous with the cartilage of external auditory canal. So whenever you will pull the pinna, patient will feel severe pain. So treatment will be analgesics to relieve the pain of the patient and to reduce the inflammation by thermolytic dressing and antibiotic that is effective against Staph aureus, because Staph aureus is beta lactamase producing bacteria. So we will give combination of amoxicillin along with clavulanic acid. Tumors of pinna and external auditory canal, we will discuss this with the tumors of external auditory canal. Chondroma, that is benign tumor, patient will present with disfigurement of pinna, swelling in the pinna that is hard to touch. So treatment will be removal of the tumor if there is disfigurement. We will discuss all these tumor with the tumors of external auditory canal. Now diseases of external auditory canal, congenitally there may be atresia, it means complete blockage of external auditory canal, or there may be partial blockage of external auditory canal, that is called stenosis. So these abnormalities can also be associated with inner ear anomalies, and patient can present with sensorineural hearing loss. Atresia and stenosis will cause conductive hearing loss. Treatment neotoplasty, it means making external auditory canal. So if there is sensorineural hearing loss, You can advise, there is no need of making a hole in the external auditory canal. If patient is having only the conductive hearing loss, so myoplasty will improve the hearing of the patient. Call oral fistula in cases of preauricular sinus. Sometimes it is not a sinus, it is a fistula. Fistula is the connection between two epithelial surfaces. External opening will be in front and above the trachea, and internal opening will be in the external auditory canal, usually at the junction of bone and cartilaginous part. So, if there is an internal opening, you have to examine the external auditory canal, and treatment is again excision of the tract. Sometimes it becomes infected and patient can present with discharge through external opening and through internal opening. And sometimes there is cyst formation inside the tract. So patient can present with swelling in front and above the tragus along with tenderness. So treatment is again surgical excision and preoperative antibiotics are given. And if the canal opening, so you have to dissect the whole tract, otherwise there will be recurrence. This tract really passes between the branches of the facial nerve, and you have to dissect the branches of the facial nerve to prevent any trauma to the facial nerve. In acquired diseases, patient can present with trauma of the external auditory canal. Trauma may be laceration that can be self-induced by putting some hard, sharp object inside the external auditory canals, just like hairpins. Gunshot wound can cause trauma in the tympanic membrane and external auditory canal. Head injuries. Longitudinal fracture of the petrous part of temporal bone can cause trauma in the roof of the external auditory canal. So there will be laceration of the skin over the roof of the external auditory canal. Then inflammation in the external auditory canal can be due to infection. Infection can be bacterial, viral and fungal. So localized otitis externa we have discussed. Fruncle that can also appear in the outer part of external auditory canal, that is the infection of hair follicles with Staph aureus bacteria. Diffuse otitis externa, that is bacterial infection involving the whole external auditory canal, and there will be swelling of the external auditory canal along with narrowing of the external auditory canal. And then malignant otitis externa, that is really seen in diabetics. We will discuss these diseases one by one. So we have discussed boil, that is infection of hair follicle caused by Staph aureus infection. So you will give ethamol glycerin packing, analgesics, antibiotics, Pope dressing. Pope dressing is the form of Mirosil packing. You will put it in the external auditory canal and you will apply ear drops containing antibiotics. It will swell up and will act as splint in the external auditory canal and will reduce the swelling of external auditory canal. So you can see this is localized void and this is generalized otitis externa. Cartilage of the pinna is continuous with the cartilage of the external auditory canal. So there will can also be patient can present with swelling of the pinna if there is perichondritis. Chronic form of otitis externa, patient will present with recurrent acute attack, and in between the attack, patient will present with severe itching in the ear. And because of continuous itching, and patient will put finger in his ear and making the external auditory canal wide, just like in this picture. So treatment of acute infection is the same. In cases of chronic, when patient present in between the acute attack, you can put steroid packing inside the external auditory canal. And in acute condition, treatment is same: antibiotic, ethamol glycerin packing, and aluminate dressing. It will reduce the inflammation and also the antiseptic. So you can give steroid ear drops or you can pack the ear with the help of steroid. Malignant otitis externa, that is also called necrotizing otitis externa, usually seen in immunocompromised diseases, most common immunocompromised diseases, diabetes, and patient on chemotherapy. So in 95% of the cases, pathogen is Pseudomonas. and in 5% it is Staph aureus. Pathophysiology of disease is that it causes osteomyelitis of the bone. Osteomyelitis of external auditory canal will damage the posterior meatal wall and it can damage the facial nerve. So it will cause microangiothrombosis and leading to necrosis of the bone. Decreased blood supply will cause necrosis of the bone, and this necrosis will be easy for bacteria to spread along the base of skull. So when it damages the posterior meatal wall, it can damage the facial nerve, and along the base of skull, it damages the last four cranial nerves, that is 9th, 10th, 11th, and 12th. So, clinical features mostly it is seen in women, and patient will present with severe pain in the ear, blood stained discharge, unresolved otitis externa even after the systemic treatment and also the local treatment, and also with the local treatment, because it damages the bone. There will be formation of granulations in the external auditory canal at the junction of bone and cartilage, that is the weakest portion in the external auditory canal. So management depend on diagnosis. So there are certain major criteria for the diagnosis of malignant otitis externa. If patient is presenting with unresolved otitis externa, it means patient is taking treatment for at least 1 month and there is no improvement in the symptoms, or during examination when you are in external auditory canal, there will be granulations, and these granulations will be at the junction of bone and cartilage of the external auditory canal. External auditory canal will be swollen, and the surrounding area around the ear will also be swollen. And then when you are advising CT scan, there will be stiff CT scan findings. What are these? These are the osteomyelitis of the base of skull. Treatment depends on diagnosis, and as it is infection, so we will treat the underlying cause. If patient is on immuno anti-cancer therapy, we will stop that treatment, and then if patient is diabetic, then we will control the diabetes of the patient, as it is infection caused by pseudomonas and Staph aureus infection. So we will give antibiotics that is effective against these bacteria. So in case of penicillin, piperacillin is important, and we can control the infection by IV aminoglycoside and piperacillin, and then we will continue the treatment for at least 6 weeks with oral ciprofloxacin. So there is dead tissue, dead necrotic tissue. So due to this dead necrotic tissue, antibiotics cannot penetrate in the deeper tissue. So we will debride the tissue. This is called debridement of the necrotic tissue. We will remove the granulations and we will remove the dead bone. Sometimes, if surgery is contraindicated, so we can give hyperbaric oxygen to improve the wound healing. Then ear dressing dipped in bismuth iodide can be dressing in the ear. What type of surgery we will do? It can be in the form of mastoidectomy. It can be in the form of vitrosectomy, depending on the area involved. You make the diagnosis of the patient. Diagnosis depends on clinical features, and then you will advise certain investigation. Lab investigation including blood CP, ESR, blood sugar level, and CRP. CRP will be raised, ESR will be raised, and there will be leukocytosis. Imaging technique important is gallium or technetium 99 imaging. The radioisotopes are given to the patient, and then films are taken by gamma camera. It is 2D pictures. Then CT scan with contrast will give you 100% diagnosis, and through MRI we can assess the soft tissue penetration, soft tissue abnormalities. We can see the neural tissue as well. So after diagnosis, we will treat the patient. Then viral infections of external auditory canal, we have discussed this, that is herpes zoster. and sometimes otitis externa hemorrhagica seen in influenza patient. And then fungal infections, we call fungal infection automycosis. There are different types of fungi that can infect the ear: Aspergillus niger, Aspergillus fumigatus, Aspergillus flavus, and Candida infection. So, Aspergillus and Candida infections are important. We have discussed this herpes zoster, and first stage will be pain, then erythema, then there will be bleb formation, then scarring, along with seventh and eighth cranial nerve paralysis. In cases of fungal infection, it is usually seen in hot and humid weather, and clinical features will be severe itching. Without itching, there will not be fungal infection. So patient will present with severe itching. After itching, patient will develop pain, then serous secretions coming out of external auditory canal, because external auditory canal contains serous glands. So it will be serous secretions. If there is secondary infection of bacteria, then pus will also come out, and this pus will not contain mucin. So it will not be sticky in nature. And in cases of candida infection, you will see curdy like material, yogurt like material, blotting paper like appearance, like in this case and in this case. Aspergillus niger will show spores, and Aspergillus fumigatus and flavus will show yellow spores. So, on otoscopic examination and with the help of symptoms of the patient, you can diagnose the case. So treatment will be suction and clearance. You will suck out this fungus. Fungus grows in the epithelium of the external auditory canal. So whenever you will remove the fungus, skin beneath this fungus will be reddish erythematous. So you will give clotrimazole, that is broad spectrum antifungal therapy, and you will give in the form of drops. And if in cases of resistance, if you are giving the treatment and patient is not improving, then you can give 2% salicylic acid in alcohol. This salicylic acid will help in removing the epithelium of external auditory canal, so it will remove the fungus. And you will also advise the patient to keep his ear dry and to protect this ear from water. So you can see this is antifungal treatment. Then other diseases of external auditory canal that is not infective may be eczematous, otitis externa, seborrheic otitis externa, and neurodermatitis. In cases of seborrheic otitis externa, there will be reddish erythematous, and there will be breach in epithelium due to scratching, and there will be history of dandruff. There will be dandruff in the scalp, and patient will give you history of scratching inside the ear, severe itching, and serous discharge. So you will perform ear toilet, you can give salicylic acid and sulfur ointment, and you will treat the dandruff of the patient, and you will moisturize the skin. And eczematous dermatitis, that is usually seen if patient is allergic to certain drops. So patient will give history of swelling after putting these drops. You can see in this picture there is swollen pinna, and you can see erythema around the pinna on the cheek and on the mastoid. Treatment is withdrawal of antibiotic ear drops, and you can also give steroid in the form of topical ointment, or even in oral steroids can also be given. Neurodermatitis, if patient will present with severe itching in the ear due to some psychiatric problem. Patient is in habit of scratching the ear. Whenever patient is stressed and there is some neural problem, or patient under stress will scratch his ear, and the scratching will lead to infection of the external auditory canal. So there will be history of intense itching. Treatment is psychotherapy, reduce the stress of the patient, avoid ear drops, and ask the patient to keep his ear moist. And patient can also use olive oil to moisturize external auditory canal, and you can also pack the external auditory canal with the help of steroid ointment. Miscellaneous condition of external auditory canal include impacted wax or simple wax, foreign bodies, keratosis obturans, that is impacted wax along with desquamated epithelium, and congenital conditions are stenosis and atresia of the external auditory canal. We will assess the inner ear function, and we will see the inner ear through CT scan. If inner ear is normal, then we will remove this atretic plate. We will remove the atresia of the external auditory canal because it is causing conductive hearing loss. Stenosis means narrowing. If inner ear is normal, you can do myotoplasty to improve the conductive hearing loss. So, miscellaneous condition is wax. Patient will present with accumulation of ceruminous gland secretions, that is called wax. Ceruminous glands are present in the outer part of external auditory canal, and wax is present in outer part of external auditory canal. If patient is using cotton bud or anything like tissue paper or his finger, patient can push the wax into the deep external auditory canal, so it becomes thick there, it becomes gets accumulated there, so it is difficult to remove that wax. So we will soften this wax with the help of soda glycerin or olive oil. It soft, we can remove it with the help of suction, that is dry method of removing the ear wax, and we can also remove it with the help of probe. Sometimes wet method is used, that is syringing. Nowadays we remove the wax with the help of suction, because in cases of syringing sometimes there may be perforation of external auditory canal. How will you perform this syringing? You will push the water in the posterior wall of external auditory canal, not at the tympanic membrane. This water will go behind the wax, and due to pressure, wax will come out. Suction is the negative pressure, it will pull the wax inside the external auditory canal. Then impacted wax, if wax in the external auditory canal is hard, wax is formed by ceruminous glands. Ceruminous glands are present in the outer part of external auditory canal, and wax naturally comes out of the ear. If it is not coming and it gets hard, then you will make it soft with the help of 5% soda glycerin, and after making it soft, you will remove it with the help of suction, with the help of probe, or with the help of syringe. Keratosis obturans is the impacted hard wax along with desquamated epithelium. It is difficult to remove, and this impacted wax can cause absorption of the bone due to pressure and causing widening of the meatus. On examination, pearly white color mass is seen in the deep meatus. Wax is present in the outer part of external auditory canal. Keratosis obturans is the impacted wax along with desquamated epithelium. Desquamated epithelium normally comes out of the external auditory canal through migration of the cells. But if somebody is pushing the wax into the deep meatus, it becomes hard along with this desquamated epithelium, and it is called keratosis obturans. Keratosis, and due to presence of keratin, it will cause inflammation of deep external auditory canal and formation of granulation tissue, and can also cause the absorption of the bone, and the deep meatus becomes white. So difficult to remove this hard impacted desquamated epithelium along with wax. We will make it soft with the help of soda glycerin, and 5% soda glycerin is given, and then this hard removed with the help of suction, syringing, and with the help of probe, and then antibiotic is given to for healing of the skin and to prevent further secondary infection, and the external auditory canal is packed with bib to prevent any infection. Other thing that can be present in the external auditory canal or that are the foreign bodies. Foreign bodies usually seen in children. Foreign bodies are of two types, living and non-living foreign bodies. Non-living foreign bodies are beads, stones, cotton piece of paper, and living foreign bodies are insects or maggots. Insects can reach the external auditory canal usually in rainy season, and it will cause severe pain in the ear. And maggots are the larval stage of the housefly. House so if there is or inorganic foreign body, beads, cotton, wool, it can be removed with the help of suction and with the help of foreign body removing hook. If it is non-living organic foreign body, that is beans, water should be avoided because beans get swollen, and it will be difficult to remove this swollen beans. So it should be removed with the help of suction or with the help of foreign body removing hook. Living foreign bodies that are maggots and insects, if there is insect in the external auditory canal, put some oil inside the external auditory canal. It will choke the respiratory system of the insect, and after killing the insect, it will be easy to remove the insect with the help of forceps or the suction or with the help of syringing. And if maggots actually are the larval stage of the housefly. Housefly lay egg in the ear in the debilitated patient, and they hatch in 4 to 5 days. It is usually seen in very unhygienic conditions and chronic discharging ear in the debilitating patient, and these larvae will cause severe itching and anaphylactic reaction. So first of all, we have to kill this larval stage with the help of maggot oil, that is mixture of turpentine and chloroform. Chloroform will make them unconscious, and turpentine will choke their respiratory system. So it is helped with the so these dead larvae can be removed with the help of suction or with the help of forceps. Crushing is avoided because crushing can lead to severe anaphylactic reaction. It comes to you if someone has already tried to remove the foreign body and it has been unsuccessful, so child will be uncooperative, so you will ask the whole of foreign body under general anesthesia to prevent any injury to the tympanic membrane, because child is not cooperative and it will be difficult to remove the foreign body. Now, tumors of the external auditory canal are usually the same as seen in the pinna. Benign tumors, osteoma, that is seen in deep meatus, fibroma, that is tissue tumor, and then exostosis and ceruminoma are the benign tumor of the ceruminous glands. Chondroma is the benign tumor of the cartilage. Hemangioma is the benign tumor of the blood vessels, and sebaceous adenoma. Sebaceous gland tumor is called sebaceous adenoma. So malignant tumor, commonest malignant tumor of the skin is basal cell carcinoma, and other tumors are squamous cell carcinoma, adenocarcinoma, and malignant melanoma. Squamous cell carcinoma is the most common malignant tumor, but the most common skin tumor is the common malignant tumor of the skin is the basal cell carcinoma. So exostosis are the multiple bony protuberances seen in the external auditory canal. Patient has been in cold water, or there is prolonged history of entry of cold water in the external auditory canal, usually seen in deep sea divers. It is bilateral, and because of this projection, if they are narrowing the external auditory canal, there will be deafness. Wax can get impacted in this narrow external auditory canal. So wax collection is common, and as well there is also formation of cholesteatoma because of accumulation of the squamous epithelium. Deep meatus can lead to formation of cholesteatoma in the external auditory canal. So treatment is excision. and diagnosis can be made with the help of CT scan, and multiple protuberance is seen, and bone is not very hard as seen in osteoma. So it is diagnosis of exostosis made by clinical examination and with the help of CT scan. Osteoma are the single bony protuberance in the external auditory canal. They can also make the external auditory canal narrow, and there may be extraction, and narrow stenosis of the external auditory canal will lead to deafness. So treatment is again excision of the tumor. You can see this is the basal cell carcinoma, and in any carcinoma, the margins of the ulcer will be everted, the base will be indurated. So you can see non-healing ulcer over the pinna. So you can also see non-healing ulcer in the external auditory canal. Melanoma, deep, you will see pigmentation, and this is highly malignant tumor. So you will see the metastasis of the tumor. So in this one diagnosis and histopathology of the tumor, in squamous cell carcinoma, lymphatic spread is more. This of squamous cell carcinoma depends on clinical features. Non-healing ulcer, base will be indurated, necrotic, and margins will be indurated and everted, and lymphatic spread is more common. So on palpation of the neck, there will be lymph node metastasis. So diagnosis is confirmed by taking biopsy and will send for histopathology, and histopathology report will prove the histology of the tumor, that is squamous cell carcinoma. Wide surgical excision along with radiotherapy, and after excising the tumor, neck is also cleared by doing radical neck dissection. Malignant melanoma is the highly malignant tumor. Patient will present with distant metastasis along with the local tumor. Chemotherapy and radiotherapy has major role in the treatment of malignant melanoma. You will remove the tumor, you will do neck dissection, and along with treatment of the metastasis. Now, tumor of the pinna and external auditory canal. Most of the skin is basal cell carcinoma, and but there can be squamous cell carcinoma and malignant melanoma. So basal cell carcinoma commonly seen in white races, usually seen in sun exposed area. Patient will present with non-healing ulcer, and it is locally malignant and will erode the deeper tissue, and lymph node metastasis is very rare, and distant metastasis is also rare. So treatment is wedge resection. More than 2 centimeters surrounding area is removed along with reconstruction. So flap is placed after excising the tumor. Then squamous cell carcinoma is again most common tumor of head and neck region, and patient will present with non-healing ulcer. Lymph node metastasis is more but are less as compared to the malignant melanoma. So local excision along with neck dissection is indicated, and most of radiotherapy is given depending on the stage of the tumor. So malignant melanoma is locally malignant, and also the distant metastasis is very common. Wide excision and chemotherapy along with radical neck dissection is indicated. Then we will discuss some scenario. A woman 40 years of age, non-diabetic, presented to ENT OPD with severe pain in right ear that is not relieved by painkillers. On ear examination, granulations are present in the external auditory canal. Tympanic membrane is normal. During her stay in the hospital, she developed right-sided facial paralysis. So, what is your most probable diagnosis? What are the differential diagnoses, and what investigation will you order in this case? And what is the treatment? So, diagnosis depends on history and clinical examination, and along with investigation. So patient is diabetic and disease is in external auditory canal with granulations. So most probable diagnosis in this case is malignant otitis externa because disease has involved the facial nerve. So it is disease that is of short duration, something abnormal than common diseases, that is granulations and facial nerve paralysis. So differential diagnosis will be tumors of external auditory canal that can also present with granulations and facial nerve paralysis, keratosis obturans that is present in the deep meatus and also resorbs the bone and then causes the granulation formation in the external auditory canal. So severe otitis externa, non-healing if boil, that is if resistant to certain antibiotics, and patient can present with this. But most common diagnosis is malignant otitis externa. Investigations are the same. Examination under microscope, you will send pus for culture sensitivity and it will prove pseudomonas, presence of pseudomonas in the culture. Then scan, then get technetium 99 scanning can also be done. CT will prove conductive hearing loss because middle ear is normal. CT scan will also show middle ear normal middle ear, and if send biopsy of granulation tissue for pathology, there will be no tumor, no malignant disease, only these will be the granulations. So treatment, three stages: control of diabetes, debridement in the form of mastoidectomy or skull-base surgery. Then third generation cephalosporin, ceftriaxone or ciprofloxacin is given at least for 6 weeks. Another scenario, a boxer presented with painful swelling on the right pinna, and for last 4 days he is also having fever and swelling. It is swelling is highly tender to touch. So and patient also having is tender to touch, so it can be boiled. It is seen in boxer. So in CNN drainage, you will drain the abscess, you will give antibiotic, then pressure dressing is done to prevent reaccumulation of the fluid or pus inside the cavity. So analgesics are given to relieve the pain of the patient. A boxer presented with painful swelling on the right pinna for the last 4 days. He also having fever and swelling is highly tender to touch. So most probable diagnosis is subpericordial abscess, and treatment is drainage of the abscess, antibiotics and antiseptic dressing, and analgesic to relieve the pain of the patient. Here